required to identify residents as an elopement risk. So resident number 1 was not assessed to be an elopement risk on their current 1823. The resident had previously eloped from the facility twice in the past 6 months. So that's like what the 1823, did that reflect currently what the resident's needs were? No, based on that. The review of the hospital record indicated the resident eloped from the facility and was found by EMS. The resident sustained a fracture of their pelvic bone and a spinal fracture. So they had serious injury. In an interview with the administrator, she stated that the resident was left alone in the living room area. So this was a resident that was identified, had previous elopements, even though they weren't identified on the 1823 to be an elopement risk. So after 30 minutes to an hour, the resident was observed missing. And the administrator told us that she drove around the neighborhood looking for the resident. She also informed us that she called the police when she could not find the resident. This is during the interview, initial. So during a follow-up interview with the administrator, she stated that she had lied and did not call the police. The police informed the facility that resident number 1 was found a day later and was in the hospital. So the facility had no idea where the resident was, and the administrator had lied to us to say that she had called the police with following their policies and procedures of what to do for an elopement. And here we go. So we reviewed the facility's wandering and elopement policy, and it said that all residents assessed at risk or with a history of elopement shall be identified so staff can be aware of any required additional safety needs. So there was a failure there. They're not following their procedure, policy of what the facility says they're supposed to do. So the facility failed to follow its policy to identify residents at risk. They didn't follow the policy when a resident went missing. The facility didn't notify police and did not notify the family or the healthcare provider. There was no incident report completed by the facility. That's one of the things for adverse incident, right? Adverse incident report's supposed to be filed, and then you do your investigation and you refile. And the resident was not wearing any kind of identification with a name or their name or telephone number. So again, there's multiple layers of deficiency that happened in this case.
So, can I ask a question? So how
Yes.
did you know that if the resident had eloped twice before? Did they have that written down, or was it just?
This wasn't one of my cases, but when I did the search of this, there was documentation in the record with the family interview that they had eloped.
So they didn't do adverse reports for that either, I'm sure.
And the 1823 didn't reflect the actual residents' needs. Because their information was that yes, the resident had eloped. So there was a history, so the 1823 wasn't accurate, didn't reflect what the residents' needs were. This is case study number 3. This is failure to provide required assistance or supervision with activities of daily living for 12 of 12 sampled residents. Yeah. I didn't make this up. So we reviewed the facility policy for care and services indicated for personal care would be provided to residents based on admission and subsequent assessments. So that's how you all know what kind of care to provide your residents, right? Your 1823 or your physician or healthcare provider assessment So this is what the resident requires or needs. And also your observations, what you believe the resident needs. So the facility policy said that the staff should be familiar with the resident's needs, that each resident would be monitored on a routine basis, that incontinence care is given every 2 hours, including nighttime unless indicated by a physician order. This is the facility's policy. This is what they said they were supposed to be doing. Full shower, bath given based on needs and preferences, daily if desired, and at least twice a week. Evening care, bedtime care includes toileting and incontinence care. And any refusal of hygiene or grooming care must be reported to the care coordinator and the administrator. So this is what the facility said they were going to provide for these residents. So interviews and record reviews we conducted with the 12 residents. Resident number 1 requires assistance with bathing, dressing, grooming, toileting, and transfers. He was observed in the wheelchair, wearing soiled clothing, had a rash on his torso, and he informed us and stated in interview that he hadn't showered in days. So an observation was made the following day, because we don't just look one time, right? Hopefully the surveyors are not just, we make multiple observations to see what's happening. So the second observation, the resident was still observed the following day in the same soiled clothes and had a foul odor. So resident number 2 requires assistance with toileting, transfers, total care with bathing, dressing, and grooming, and the resident is a paraplegic. So he was observed in his hospital bed. He said that there was no staff available at night to assist him with activities of daily living. And when he had an issue, since he was unable to get up in himself and call, his roommate would go in the hallway and yell for help. So that could have been a concern, right? It's like, why does he have to go in the hallway or get up? Was there a call bell? That kind of thing. Yes.
So, and this individual was paraplegic, but they were at an assisted living facility?
Mm-hmm. So resident number 3 requires assistance with toileting, bathing, dressing, grooming, and the resident is incontinent of urine. So she said she had been showered in a week, and staff had not asked her if she wanted to shower. She complains that the evening shift does not like providing incontinence care. So again, we're seeing like multiple residents with concerns with ADL care. And I'm bringing this case study up because I think sometimes we don't concentrate as much on this topic, but it's really important, and I wanted to show this was, very disturbing case, because there's so many of the residents that were not getting the care they required. So resident number 4, again, assistance with toileting and bathing, and was incontinent of urine. So the resident said they had made requests from staff and told they were too busy, and he did not have his diaper changed, but they offered him adult wipes. So, I don't know if an adult wipe could clean somebody that's incontinent of urine day after day. Resident number 5 requires assistance with toileting and bathing, and again, the resident is incontinent of urine. The resident had not showered in days and had to use adult wipes to clean herself. She stated that many nights there were no staff assigned to her floor, and she had no call bell to call them. Resident number 6 required ADL care, and he had a below-the-knee amputation, and during the night, with no call bell, he would have to yell out for help. And he stated he had not had a shower in a week. Resident number 7 required assistance with toileting. He had a urinary catheter. Frequently the collection bag is full and there's no staff available to assist him at night. He stated there were no call bells and the staff do not make rounds to check on him. So we interviewed a case manager that was responsible for all of the residents, and she stated that the residents had expressed frustration about not receiving the adequate care, and the residents had notified the administrator about the staffing and there had been no response. So do you feel like, again, this is multi-layers, right, of residents that have been assessed to require a certain level of care. They're making, during interviews, they're making their concerns, expressing their concerns. There's documentation that the residents have informed the administrator and their case manager, and yet the care hasn't improved. These are the names of those of you who are not familiar with our field office managers. We have a new field office manager in Tallahassee. Her name is Crystal. I guess there's her name and telephone number.